My name's Candice Buchel. I live in Montclair, New Jersey. I'm the mom to 4 girls, and I invest in real estate. So I've had bad allergies really since I went to college. I tried all of these different types of medications. Nothing was working well enough. But once I realized there's something else I could do, and my ENT was just like, come over here to Dr. Silvers, and that this would make the most sense for me.
Yeah, my name is Stacey Silvers. I'm a practicing otolaryngologist. I specialize in minimally invasive rhinology, so the function of breathing and sinuses. And I realized, you know what, there's got to be less invasive ways to do sinus procedures. I started doing balloon sinuplasty almost 20 years ago. I was actually part of the FDA trials getting the procedure approved as an in-office procedure done under local anesthesia. And in really understanding the way the sinuses work and the way we need to just make millimeter changes in anatomy, now that I've been doing it almost 20 years, with the number of lives that I've improved, it makes a lot of sense.
I think I'm so often put myself last, and I minimize anything that's going on for me. So it was very easy to be like, it's not a big deal. This is just part of life. But I really would love to not have sinus infections that often.
I'm Vivian Sen. I work in nonprofit philanthropy. I had the procedure done in 2018. It was pretty straightforward. All I had to do was take the morning off.
The procedure itself actually only takes about 15 minutes, so it's very quick. I tell patients balloons don't stay in there. They're simply used to open the doors, and then they're taken out. I usually have them stay in the office for about 15 minutes after, as long as they feel like they need to.
I was just always getting sick. So for decades, I was always getting sinus infections. It was just becoming a normal part of life. And right after I got the procedure, I just stopped getting sick as often.
So this procedure works and has long-term benefits because we are changing the anatomy. We are taking those sinus doors that are made of eggshell-thin bone, and by passing a balloon into that space and dilating it, we are physically moving the bone. And that is a permanent change. So we can take that less than a millimeter opening and make it 3 millimeters, which is enough space to allow air to get in and mucus to clear.
Dr. Silvers is also very good at explaining, so at least I knew what was happening as it occurred.
I know if I had it, I'd want to be talked through it. I want patients to know that everything they're feeling is exactly what they're supposed to feel. All right, I'm going to go ahead and take the cotton out on the right. Okay, I'm going to start on the right side. They're able to go home, they can go to work the next day, they can go to the gym the next day.
Even on the occasion when I did get sick, I'm not sick for as long as I used to be, and I'm not hit as hard as I used to be. So it's really remarkable how big the difference is. It's really changed my life.
The key is really to reduce facial pain, reduce pressure, improve breathing, and reduce infections. And in the majority of my patients, that's exactly what they get. The feedback I've gotten is life-changing. And also, everything is relative. You can't control the air patients breathes. There's other factors involved besides the structure of the sinus. But for patients that have that classic structural blockage, they tend to do very well.